Very good evening to all of you. Today we are going to do internal medicine. Internal medicine is a very important subject as far as NEET PG or INSCT is concerned. It has about 35 questions, 25 to 30 questions coming directly in the medicine exam. So let us begin with in the NEET PG exam. So let's begin with the first multiple choice question. Which of the following is the most common extraglandular manifestation of primary Sjogren's syndrome? A. Arthralgia. B. Lymphoma. C. Peripheral neuropathy. D. Raynaud's phenomenon. The most common extraglandular manifestation is arthritis or arthralgia. Raynaud's phenomenon is second most common extraglandular site. Lung involvement and vasculitis are found in less than 20% of cases. So the correct answer here is A. Arthralgia or arthritis. So most common extraglandular manifestation of Sjogren's primary Sjogren's syndrome is arthralgia or arthritis. Which one of the following clinical findings excludes the diagnosis of polymyositis? A. Neck muscle involvement. B. Extraglandular muscle involvement. C. Dysphagia. D. Abdominal muscle involvement. So polymyositis, it usually manifests as symmetric and proximal weakness. Symmetric and proximal weakness that worsens. They do not have rash or involvement of extraocular and facial muscles. So the correct answer here is B, extraocular muscle involvement. Which of the following condition is associated with normal anion gap metabolic acidosis? A. Cholera. B. Starvation. C. Lactic acidosis. D. Ethylene glycol poisoning. A normal anion gap metabolic acidosis is caused by loss of bicarbonate with a reciprocal increase in chloride concentration. It is also known as hyperchloremic acidosis. It most commonly results from abnormal gastrointestinal or renal losses of HCO3 minus. Diarrhea is the most common cause of hyperchloremic metabolic acidosis. Cholera is associated with massive diarrhea. This diarrheal fluid consists of small bowel, biliary, and pancreatic fluid, which contain 20 to 50 milliequivalent per liter of bicarbonate. This loss of large volumes of fluid leads to hyperchloremic metabolic acidosis. So the correct answer here is A. Cholera. All of the following are neurological channelopathies, except A. Episodic ataxia type 1. B. Spinocerebellar ataxia type 1. C. Familial hemiplegic migraine. D. Hypokalemic periodic paralysis. See, this is spinocerebellar ataxia type 1 is not a neurological channelopathy, but spinocerebellar ataxia type 6 is the neurological channelopathy. What are channelopathies? Channelopathy refers to a wide variety of neurological disease caused by dysfunction of ion channel in the excitable membranes. These are due to inherited mutation of gene encoding ion channel in muscle, neurons, and glia. Severe myoclonic epilepsy of infancy, episodic ataxia, excuse me, type 1 and 2, familial hemiplegic migraine, spinocerebellar ataxia type 6 are examples of neurological channelopathy. So the correct answer here is spinocerebellar ataxia type 1. It should be spinocerebellar ataxia type 6, they have given it spinocerebellar ataxia type 1. So it is the exception. Most common identifiable cause of dilated cardiomyopathy is A. Alcoholism, B. Viral infection, C. Myocardial ischemia, D. Myocarditis. It is myocardial ischemia. Diagnostic feature in rheumatic heart disease is A. Aschoff nodule, B. McCallum's patch, C. Adenocarcinoma, D. Alveolar cell carcinoma. The correct answer here is Aschoff's nodule. Aschoff body is pathognomic of rheumatic fever. Aschoff body are focal inflammatory lesion that may be found in any of the three layers of heart: pericardium, myocardium, endocardium during acute rheumatic fever. Aschoff body consists of foci of swollen is eosinophilic collagen surrounded by lymphocytes, occasional plasma cells, Aschoff giant cells. So the correct answer here is A. A student unable to deliver a speech before audience is suffering from A. Social phobia, B. Obsessive compulsive disorder, C. Agoraphobia, D. Claustrophobia. This phobia is a persistent and morbid fear of specific situation, object, or activity. The fear is morbid because the fear is irrational. The objects or situation do not produce fear in normal persons. The fear is out of proportion to dangerousness perceived that the affected person avoids the situation permanently. Patient is unable to control the fear and is very distressed by it. The common types of phobia are: number one, agoraphobia. This is an example of irrational fear of situation. It is the commonest type of phobia encountered in clinical practice. It is characterized by irrational fear of being places away from familiar setting of home, and patients believes that he cannot escape from these places to a safer place. This fear results in avoidance of these places, which include public places, store, crowds, traveling alone in bus, train, or plane, theaters, tunnels, bridge, standing in line, small enclosed rooms, or lifts. Patient is afraid of all the places or situations from where escape may be perceived to be difficult if he suddenly develops embarrassing or incapacitating symptoms. These embarrassing or incapacitating symptoms are classical symptoms of panic. A full blown panic attack may occur, or only a few symptoms like dizziness and tachycardia may occur, which is known as agoraphobia without panic disorder. Then coming to social phobia. In social phobia, there is irrational fear of one or more social or performance situation in which the person is concerned about negative evaluation or scrutiny by others. For example, public speaking, writing, drinking, eating in public, using public laboratories. Feared social or performance situation may produce anxiety, even a panic attack. Therefore, feared social or performance situation are avoided. Then comes simple phobia or specific phobia. These are phobias limited to highly specific objects or situations. They include claustrophobia, fear of closed spaces; acrophobia, fear of high places; zoophobia, fear of animals; pyrophobia, fear of fire; xenophobia, fear of strangers; algophobia, fear of pain; thanatophobia, fear of death; mysophobia, fear of dirt, germs; erythrophobia, fear of blushing; cytophobia, fear of eating; Cetophobia, fear of dogs; hydrophobia, fear of water. So the correct answer here is social phobia. Chronic lymphocytic leukemia is associated with individuals more than 50 years of age, mature small lymphocyte, hepatosplenomegaly lymphadenopathy. So the correct answer here is D, all of the above. Which of the following can cause delirium, hypoxia, barbiturate, alcohol withdrawal? D, all of them. Now, what are the important causes of delirium? Trauma, head injury, subdural hematoma, infection, septicemia, pneumonia, endocarditis, metabolic hypoxia, hypercapnia, uremia, CHF, hepatic failure, porphyria, metabolic acidosis, or alkalosis. Endocrine, hypo or hyperpatriotism, hypo or hyperthyroidism, hypo or hyperparathyroidism, hypo or hyperadrenalism. Drug intoxication, alcohol, barbiturate, TCA, anticholinergic, anticonvulsant. Drug withdrawal, alcohol, sedatives, hypnotics. Nutritional deficiency, vitamin, thiamine, pyridoxine, niacin, B12, folic acid, protein. Post-operative seizures and sleep deprivation. So the correct answer here is D, all of them. In Marfan syndrome, aortic aneurysm occurs most commonly in A, ascending aorta, B, descending aorta, C, abdominal aorta, D, arc of aorta. The majority of patients with Marfan syndrome have ascending aortic aneurysm. formation as their initial vascular event with subsequent vascular problems involving primarily the descending thoracic aorta. So the correct answer here is A, ascending aorta. Please click the link in the description box to join Ultimate Neet PG Breakthrough Blueprint. It is a 2-day event covering all the important subjects of Neet PG in a holistic manner. It will boost your revision and take your preparation to the next level. A patient has a right upper limb BP of 180 by 95 millimeter of mercury and a left upper limb BP of 130 by 90. He also has early diastolic murmur in right second intercostal space. Which of the following would be least likely associated with these findings? A. Supravalvular aortic stenosis, B. Coarctation of aorta, C. Takayasu arteritis, D. Aortic dissection. It is coarctation of aorta. Coarctation of aorta is the sixth most common lesion in congenital heart disease. Most patients have discrete narrowing of the descending aorta at the insertion of ductus arteriosus. Clinical features, closure of. So the correct answer here is coarctation of aorta. Aspirin-sensitive asthma is associated with which of the following? A. Obesity, B. Urticaria, C. Nasal polyp, extrinsic asthma. Aspirin-sensitive asthma it manifests as a tetrad of asthma, nasal polyps, chronic hypertrophic eosinophilic sinusitis, and aspirin intolerance. So the correct answer here is C. Nasal polyp. Infertility in Cartagena syndrome is A. Oligospermia, B. Blocking of epididymis, C. Asthenozoospermia, D. Undescended testis. It is asthenozoospermia. Cartagena syndrome, also called primary ciliary dyskinesia. There is bronchiectasis, situs inversus, sinusitis. In males, most men with this problem have are living spermatozoa, but they are immotile, which is called as asthenozoospermia, and are infertile. So, how do you diagnose primary ciliary dyskinesia? Reduced exhaled nitric acid level is used as a screening tool. Gold standard diagnostic test is transmission electron microscopy of nasal biopsy specimen to view the ultrastructural defects in the dynein arm within the individual cilia. So it is known as primary ciliary dyskinesia. Sleep apnea is defined as temporary pause lasting at least A 40 seconds, B 30 seconds, C 20 seconds, D 10 seconds. It is 10 seconds. A boy is suffering from acute pyelonephritis. The most specific investigation is A histopathologic examination, B. Leukocyte stress test. C. Nitrate test, bacterial Gamston. C. This acute pyelonephritis is a bacterial infection causing inflammation of kidney and is one of the most common diseases of kidney. Pyelonephritis occurs as a complication of ascending urinary tract infection which spreads from bladder to kidneys and their collective systems. Symptoms usually include fever, flank pain, nausea, vomiting, burning on urination, increased frequency and urgency. The two most common symptoms are usually fever and flank pain. E. coli is the most common bacteria causing acute pyelonephritis due to its unique ability to adhere to and colonize the urinary tract and kidney. Histopathology usually reveal necrosis or putrid abscess formation with renal parenchyma. The renal tissue are infiltrated with neutrophil, macrophage, and plasma cells. However, architecture is not completely disorganized. So the correct answer here is histopathological inflammation. 12-year-old boy presented with gross hematuria with 80% dysmorphic RBC 2 days after the attack of upper respiratory tract infection. Diagnosis is A. Microangiopathic thrombotic anemia, B. IgA nephropathy, C. PSGN, minimal chain disease. Clinical features of IgA nephropathy more common in males than females by a ratio of 3:1, whereas the ratio approaches 1:1 in most Asian population. Hematuria is usually visible within 24 hours of onset of symptom of infection. Which of the following is not a feature of extramedullary tumor? A. Early corticospinal signs and paralysis. B. Root pain or midline back pain. C. Abnormal CSF. D. Sacral sparing. Intramedullary and extramedullary syndromes. Extramedullary lesions, radicular pain is often prominent, early sacral sensory loss, spastic weakness in legs, incontinence. Intramedullary, poorly localized burning sensation rather than radicular pain, spare sensation in perianal and sacral areas. So the correct answer here is sacral sparing. Sacral sparing is seen in intramedullary. It is not a feature of extramedullary. Treatment of choice for Kawasaki disease. We all know Kawasaki disease. The treatment of choice is IV immunoglobulin. So the correct option here is A. Please click the link in the description box to join the ultimate Neet PG Breakthrough Blueprint 2-day masterclass covering all the 19 subjects in a holistic manner. And the first 10 people who click the link in the description box will get this class absolutely free. Borderline personality disorder is A. Chronic feeling of emptiness, B. Unstable interpersonal relationship, C. Grandiosity, D. Low self-esteem. Borderline personality disorder. The central feature of borderline personality disorder is a pervasive pattern of unstable and intense interpersonal relationship, self-perception, and mood. Patient make recurrent suicidal threat and gesture, and a small proportion of patient carry out the act of self-mutilation like cutting or burning. Patients have difficulty in controlling their anger and impulsivity. There is uncertainty about personal identity. It is known as unstable interpersonal relationship. Indications for ECT are all. A. Severe depression with suicidal risk. B. Catatonic schizophrenia. C. Severe psychosis. Severe manic attack. Except severe depression with suicidal risk. Which of the following most specific tests for rheumatoid arthritis? A. Anti-CCP antibody. B. Anti-IgM antibody. C. Anti-Ig antibody. D. Anti-IgG antibody. It is anti-CCP antibody. True about tumor lysis syndrome are all except A. Hyperuricemia, hypercalcemia, hyperkalemia, hyperphosphatemia. The correct answer here is B. Hypercalcemia. Tumor lysis syndrome is characterized by hypocalcemia, not hypercalcemia. The gold standard for diagnosis of insulinoma is A. 72-hour fast test, plasma glucose level less than 3 millimole per liter, plasma insulin level more than 6 microun per ml, C-peptide level less than 50 pmol. It is 72-hour fast test. Urinalysis of patient with hematuria and hypercalciuria most likely to reveal isomorphic RBC, RBC cast, nephrotic range proteinuria, eosinophilinuria. It is isomorphic RBCs. Most specific sign of metabolic encephalopathy is A. Asterixis, B. Abulia, akinetic mutation, apraxia. It is asterixis.